The next 2 or 3 years will pass by either way. So reflect on your goals and where you want to be at that time. My name is Carey Landry, and I graduated from the Executive Masters of Business Administration at UFred with a specialty stream of business analytics. I'm married with 2 boys. They're right now age 7 and 10. I enjoy reading, traveling, and really just spending downtime with the family and our dog, Rosie. I'm the director of the Southwest Regional Cancer Program, which oversees the quality and delivery of cancer services for residents of 7 counties in southwestern Ontario, all the way from the Bruce Peninsula down to Lake Erie. I'd been in my previous healthcare manager role for 8 years, and I was very comfortable, but I was a bit restless. So I needed a new challenge. Education's always been a passion of mine, and I have a strong background currently in science and medical research, but I really wanted to hone my leadership and business skills to take my career to the next level and have a new challenge. So I think I was confident because I was reassured by the flexibility of the program model. Needing to balance studies between my job and my mom duties, and the fact that I could attend class from home every day was very appealing to me. I also liked the idea that I could skip a term if I needed to, if life circumstances came up, and then I could jump back in right where I left off because of the way the program was designed. I think the UFred education has benefited me in a lot of ways. As a leader, you pick up bits and pieces of business structure and function as you're gaining that real life work experience. But the UFred program kind of tied all that together with the foundational knowledge. I did make a vertical movement in my career path from manager to director. I've become more confident with giving presentations at work, which is essential to the role. I've also improved my ability to develop solid business cases to drive program growth and development. So it has really enhanced my work experience and also improved confidence in different areas of my role. Probably I'd have to say the most interesting place I attended a class was on the train ride, the Via Rail train ride back from my job interview in London to Ottawa, where I was living at the time. So I was able to tether to my phone's Wi-Fi and use AirPods to learn about finances with Dr. Dana. Definitely my highlight was the Global Capstone Projects field study in Amsterdam. We had an intensive week-long session of learning from multiple successful business experts to help facilitate our project progress and also learn about real-life business applications. Of course, also meeting the teammates in person that we've been working with, some for months and years. We finally got to meet in person, experience some nice Dutch cuisine and sightseeing before coming back home. So those were some bonus highlights of the experience. In terms of return on investment, idealistically, you could say that the return on investment's immediate because you can't put a dollar value on education. And I accomplished my PhD in 2011. So I'm always kind of a lifelong learner and I always see the value there. But I also feel that having my MBA underway strengthened my application to my current position and helped me make that transition from manager to director. I'm proud of having a deeper understanding of what it means to take a systems level approach to leadership. My proudest work is probably work done with the transplant program development at London Health Sciences. So last fall, we introduced an outpatient autologous self-donated stem cell program. So the outpatient model allows us to improve patient experience and free up hospital beds. So it's a win-win. And then more recently, we launched an unrelated donor stem cell service at LHSC at London Health Sciences. So this means that patients can now receive care closer to home rather than having to move to another city for this month-long procedure. So these are a few examples where transformational leadership and team leadership came into play to be able to have successful outcomes and improve quality of life and experience for patients in our region. For people who are too busy to go back to school or think they might be and aren't really sure, I'd say, the next 2 or 3 years will pass by either way. So reflect on your goals and where you want to be at that time and use your vision to guide your path. I think the UFred program is very realistic, achievable accomplishment. If it aligns with your vision, it's a good thing to do.